Have you had difficulty conceiving and carrying a pregnancy to term? It can be difficult to talk about. This is a painful and emotional subject. It can destroy self-esteem and poison family life. Unfortunately, the inability to conceive and bear a child is a common story in the modern world. One of the most frequent causes of miscarriage is endometrial disorders caused by diseases such as Asherman syndrome, chronic endometriitis, polyps, and endometrial hyperplasia. What is the endometrium and why is it so important? The endometrium is a layer of cells lining the inner walls of the uterus. The embryo attaches to this layer of the uterus. The condition and thickness of the endometrium determines the possibility of pregnancy, the successful course of pregnancy, and successful childbirth. What can you do if the endometrium is thin and your long-awaited pregnancy fails? Now there's a solution. Today, it's possible to bear your own child without surgery and without using surrogate programs. The Ilaya clinic has developed a new technique that can regenerate the endometrial layer you need for your own pregnancy using your own stem cells.
We've been working with stem cells in our biotechnological laboratory for 8 years. Stem cells are the future of medicine. Our team of specialists uses them to treat conditions such as type 2 diabetes, joint diseases, liver disease, autism, and multiple sclerosis. And stem cells are also used in our cosmetology and anti-aging programs. We also use the potential of stem cells in the treatment of infertility.
This treatment can be effective for women with conditions including endometrial thickness of less than 6 mm, synechia, dense adhesions in the uterine cavity, and chronic inflammation in the uterine cavity. It's not suitable for women with infectious diseases, third-degree Asherman syndrome, or malignant neoplasms anywhere in the body. Our program uses adult stem cells from the patient's own body with subsequent hormonal support.
While we can use stem cells from adult donors in certain other procedures, our infertility treatments use only the patient's own cells because we plan to integrate them and stimulate the patient's own potential for developing endometrial tissue. This approach allows us to reduce the risk of an immune response from the patient's body.
To see whether this procedure is right for a patient, one of our doctors does an initial consultation and we perform laboratory tests. Once we confirm there are no contraindications, we begin the procedure for collecting material, which is possible from the 5th to the 7th day of the menstrual cycle. We do an endometrial cell biopsy with a thin tube called a Pipelle aspirator. The extracted tissue is transferred to our biotechnologists and the patient is sent home. After 3 to 4 weeks, during which we grow new stem cells in our lab, we conduct a hysteroscopy to introduce the therapeutic dose of stem cells into the walls of the uterine cavity. The patient is prescribed hormonal drugs to support the integration of the introduced cells. The growth of the uterine mucosa is then monitored by ultrasound throughout that menstrual cycle. After the endometrium is restored, pregnancy can occur naturally or via in vitro. Sometimes, in very complicated cases, we need to repeat the stem cell transfer procedure. Usually we do it 2 to 3 months after the first transplantation of endometrial stem cells. Endometrial regeneration is absolutely safe for women and unborn children because it uses the patient's own stem cells. Immune rejection of the transplanted material, allergies, and other immune responses are also ruled out. This innovative solution is available to you today, and our team of dedicated doctors and biotechnologists is improving our technology all the time. Make an appointment for a consultation and give yourself a chance at motherhood.